The most sensitive and humane aspect of hospital care is end-of-life care. When recovery is no longer possible, hospitals must ensure pain relief, patient dignity, emotional support, family involvement. But if end-of-life care is not handled properly, patient suffering increases, family distress increases, ethical and legal issues arise. That is why NABH introduced the COP20 standard, ensuring care is compassionate, ethical, and legally compliant. What you will learn in this video. In this video we will understand what NABH COP20 standard says, what assesses check in end-of-life care, common NABH non-conformities, how hospitals can become COP20 compliant. Let's begin. What is NABH COP20 standard? The COP20 standard states, end-of-life care is provided in a compassionate and considerate manner. This means hospitals must ensure patient dignity, comfort-focused care, family-centered approach, while maintaining ethical and legal compliance. Objective elements of COP20. COP20 includes end-of-life care policy, multi-professional care approach, legal compliance, patient or family needs identification, symptomatic treatment and pain relief. Assessors verify these through policies, patient records, counseling documentation. End-of-life care policy. Hospitals must have a written SOP, policy based on national guidelines, international best practices, applicable laws. Components of end-of-life care. End-of-life care includes pain management, palliative care, supportive care. Focus is on comfort, not cure, respecting patient wishes. Care must be provided according to patient wishes, family preferences. Hospitals must also sensitively handle organ donation discussions, autopsy-related communication. Cultural and emotional support. Hospitals must respect cultural beliefs, religious practices, social values. They must also provide emotional support, psychological counseling, spiritual care. Multidisciplinary care team. End-of-life care requires a team-based approach. Core team includes treating doctor, nurses. Additional team members may include psychologist, rehabilitation specialist, palliative care expert. Legal compliance. End-of-life decisions must follow legal frameworks. Examples include do not resuscitate, do not intubate, allow natural death. These decisions must align with ICMR guidelines, Supreme Court directives, living will, advance directive, patient or family needs. End-of-life care must address patient needs, family needs, including emotional support, anxiety management, cultural and religious needs. Staff training. Hospital staff must be trained in compassionate communication, end-of-life counseling. This is critical for handling sensitive situations. Symptom-based care. End-of-life care focuses on symptom relief, pain control, comfort care. Goal: improve quality of remaining life, family participation. Major decisions must involve patient, if possible, family members. Hospitals must respect patient autonomy, family choices, within legal limits. Documentation or ethics. Hospitals must ensure proper documentation of decisions, counseling records maintained. All care must follow ethical principles, transparency in decision making. Common NABH non-conformities in COP20. Common observations include end-of-life care policy missing, DNR documentation not available, family counseling records incomplete, palliative care involvement missing, legal documentation absent. Hospitals must address these gaps to avoid NABH non-conformities. How hospitals can become COP20 compliant. Hospitals can comply with COP20 by developing end-of-life care SOP, training staff in palliative care, ensuring legal compliance, strengthening counseling documentation, promoting a compassionate care culture. These steps help hospitals effectively comply with NABH COP20 standards. This was the final standard of the NABH COP chapter, COP20. If you have followed this series, you now understand complete NABH COP standards from COP1 to COP20. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.